This is Marni from Kino. Today we're doing a demo of a typical bodywork session. I say typical because every bodywork session is different. This is somewhat typical. Quinn has elected to stay fully clothed for her session, which is usual for a bodywork session. We're starting in the abdomen today. With most clients, I will start with the pelvis or with the abdomen. There is so much muscle tension, emotion, fascial connections, a lymphatic flow, nerve flow in the abdomen that it is absolutely critical to address that area in any session. Many clients, when they come to Kino, have never had body work where their abdomen was worked on. And I feel like I would be doing a disservice to the client if I neglected to work or to touch or to bring my attention into this really vulnerable area. In this case, I'm listening with my hand to the movement of the sacrum. The sacrum naturally rocks at about 8 to 12 cycles per minute as it reacts to changes in the pressure of the cerebral spinal fluid. So I'm noticing those subtle movements in her sacrum. I'm also starting to become aware of what's going on in the entirety of her being. We're having a conversation to find out where she's at, what's she noticing, what's really important to her today, and what's coming up for her. In a bodywork session, we address the entire body. So we're not just addressing the skin or the fascia or the physical as you might in a Swedish massage. In this case, we're addressing the mental, the physical, the emotional, and the spiritual bodies. So it's the entirety, the totality of her being that is important in this session. And every session is different. I will ask the body or the inner physician, the inner wisdom, what is the focus for today? Where do I need to work? How do I need to work? What do I need to say to this client? My body work includes a large component of Cranio-Sacral Therapy. And as part of Cranio-Sacral Therapy, we have this understanding that the body has an inner wisdom. Her body knows exactly how it needs to unwind. Her body knows exactly what it needs to heal, and it knows what I can best offer to her today. In other words, I trust that spirit, her body, her inner physician, her higher self, God knows how this session needs to unwind. Her spirit knows the therapist is coming in to work on her today, how I can best serve her. So I've continued to work from her belly in through the chest, and now we're addressing the anterior neck or the hyoid bone, opening up the avenue of expression, if you will. As I'm moving up to her neck, I really enjoy neck work. I'm allowing slow myofascial release. So I choose to work at a pace and at a pressure that is comfortable to the client. I would prefer to stay at a level that is below the pain threshold, allowing her to stay focused, to stay in her body, to bring her attention into the area where I'm working, allowing the tissue to unwind not only where I'm touching, but also throughout the entire body. Some magic happens when we both bring our attention into the same area. It is as if the tissue just suddenly relaxes when my attention is there and her attention is in that same spot. From here, I'm sensing an unwind not only in the cervical vertebrae, but the larynx, the vocal cords, the front of the neck, her chest, her belly, the pelvis, all the way down the leg and even into the foot. It's not unusual as we do these slow, mindful releases that we may happen upon a energy cyst or a place where trauma is held in the body. It's common that a client might cry, have memories or emotions that are held in these tender places as we take the time to slowly, mindfully, and respectfully unwind the body. As I'm moving to her head, I'm listening, I'm feeling the subtle changes in the movement of the cranial bones. In high school biology, they teach us that the bones of the cranium are fused in adulthood. That's not entirely correct. The cranial bones elongate and widen in a rhythmic fashion of about 8 to 12 cycles per minute. Here I'm noticing where those bones are not moving and using subtle, very gentle pressure, perhaps some direction of energy to invite those cranial bones to move in an optimum fashion. And I'm following. In some cases, I might move back to her neck or to another part of the body. Bodywork sessions tend to have no routine. No one session looks the same. I'll move from one part of the body depending on where I'm called. The most important thing here is to remain present. As a body worker, I need to stay fully focused, present in the room, focused on my client, holding the energy for the entire space. When we work with families, I'm creating a sacred space for the whole group, everyone in that room. As you can see, we're engaged in conversation here. It's unlikely that it is just a small talk, talking about the world or your pets or your dishes or your laundry list. That's typically not the part of the bodywork session. More often than not, I'm asking questions. What are you noticing in your body? What are the physical sensations? What emotions or memories are coming up? Sometimes spirit will give me a word or an age. Sometimes I might be led to ask what happened when you were 3 years old. Very often I'll be called to place my hands on a certain part of the body, a part of the body that you may have learned to not feel. And as you feel into that spot, there could be emotion or memories held there. Here I'm noticing something happening in her belly, and her body is calling for a full body unwind here. You can see that no session is the same. This is not typical, and yet it is not uncommon. I've curled her up into a fetal position, noticing the tight spot or the energy that's being held in her belly and just creating a softening, a space around that so that she can unwind in the way that her body best wants to unwind. Here we are unwinding the arm. Slowly, gently, mindfully, I'm noticing what's happening not just in her bicep or deltoid, not just the forearm, but the muscles in her chest, the pectoral muscles, the attachments to the sternum, the attachments at the clavicle, even reaching fascially down into her belly and her pelvis. And we're also working on opening the energy around the heart chakra. This is a bodywork technique that I developed to unwind the arm. Fascially, we're just following the unwind all through the body. And I'm shortening the joints so that the muscle under my hand, the anterior deltoid there, is softened. It can best release when it's in a shortened position. And as I slowly manipulate the arm, I'm feeling the muscle fibers that can best unwind in each position. Here you can see I've moved back to her belly We're specifically working on the hip flexors here, iliacus and psoas. A hip flexor could better be called a leg lifter. It's the muscles that raise the knee towards the face. And they are shortened in a seated position. You can see I'm lifting up her leg to find the place where the psoas is the softest. We're continuing to communicate, to talk about what's going on with her body, trying to find those places where she's holding, where she's blocking, where she can be a little more aware. I break all the rules. As you can see, when I put my knee on the table there, that's simply for my own leverage. There are some massage establishments that would not allow that. But I would say that in bodywork, we do whatever we have to do to find the optimum position for the body to unwind, and also taking care of my body mechanics. It's important that I don't hurt myself so that I can continue to work for many more years. Here I return to the head. More than anything at this point, I believe that we're checking the energy as we're starting to come to maybe a stop in the session or a close of this section. I'm checking the cranial rhythm again, checking her energy, noticing any fascial restrictions or where she might be stuck. Also a recheck. Where do we need to go next? As you can see, Brendan has joined the session. Brendan was one of our students here at Kino who mentored with me. And in that process of choosing a mentor, our students are invited to observe bodywork sessions with our advanced and master therapists. And as they become more proficient and more educated, we often invite them to help us to actually work on the client while we are doing our work as well. And there's this amazing thing that happens when two therapists or multiple therapists get to work on the client at the same time. It is as if the body shows us areas that need attention that perhaps, it wasn't shown to me as an individual therapist, or perhaps it would have taken much more time, many more hours, many more sessions to get to that place. That because of the energy of both therapists, because of the positioning, because of what we're able to do with 4 hands instead of 2, we're able to affect much deeper or different releases. As body workers, we work on the totality of the human being. So we are working on the physical, the mental, the emotional, the energetic, and the spiritual parts of the body. What we have found is that it's much more than just the physical. Some would say that the energy field around the body creates the physical. But what I can tell you is that if we don't address all those other parts of the being, the physical often never completely heals or completely resolves the issue. In this case, you have seen Brendan flicking energy off of the body. He's actually sensing the aura and the energy inside her belly and is helping to smooth, to move out perhaps dense energy or something that's no longer serving, that she's holding on to, and just flicking that energy back. In an esoteric sense, we would say that we're sending that back to Mother Earth to be recycled for the best and highest good of all. In this case, I choose not to overcomplicate it, but we're just moving energy out. Just smoothing her aura, smoothing the energy field of the body. So we're helping her to not just relax, but to actually inhabit her body. As Brendan is jiggling the leg, you can see that we're actually moving energy by the movement. That movement moves energy and connecting her upper body with her lower body, helping to open up those meridians. And the effect is that this is much more than a Swedish massage. So as we do this advanced body work, we're addressing all of the being. And as she walks away from this session, I would expect for her to be more centered, more comfortable in her body, more at peace, more at ease, lighter, if you will. And what I mean by lighter is that less concerned with the limiting beliefs, with the worries, with the trauma, with the pain that perhaps she had when she came in today. More comfortable, more in love with yourself, more at ease in the world. And the beautiful thing about body work and about doing the inner work to really find true long-term healing is that you affect not only yourself, but everyone you come in contact with. And I believe that you affect even those people that you don't come in contact with simply by changing your emotional state, your vibration, the energy that you project into the world. So as I'm communicating a lot with the client, part of this is also coaching. It's helping her to realize where she's holding in her body, helping her to become more embodied, to feel. We found that humans as a race, as a collective, have done a really good job of learning how not to feel. We learn to not feel our physical sensations, our pain, and our emotions in order to survive. A lot of what we do is to teach people how to feel again, how to truly feel what's happening in their bodies, in their energy field, and in their emotional body. And it's a whole nother video talking about how we coach and connect and help people to describe and help to release and help to heal those traumas that are held in the body. As we start to close this session with Quinn today, we're balancing the energy field. We're asking her body if there's anything else that needs to happen before we bring the session to a close. I'd like her to leave in a balanced, relaxed state as she's going out into the world, calm, at ease. Hopefully she'll sleep really well tonight. And at Kino, bodywork sessions are available from all levels of therapists. Every session is unique. Come in expecting to find more of your true self, wear comfortable clothing, and communicate your needs and wishes to your client. Remember that we're here to hold space, to facilitate, to bring all of our gifts, skills, intuition, and experience, and to listen to what your body is telling us, but to also listen to what your needs are today. You are always in control. You have the right to ask for less pressure, a blanket, a change in direction, or to ask me to just be quiet at any time. Okay. I am truly honored to be able to do this work. I never imagined when I went to massage therapy school that this is the kind of work that I would be doing. So far away and removed from just a Swedish massage, and yet we incorporate elements of Swedish massage into every bodywork session. It has taken me years to become the bodyworker that I am today. Much of that work has been doing my inner work, my shadow work, healing my own trauma and my own limiting beliefs, learning to move energy within my body, and learning basic massage, therapeutic massage, medical massage techniques that I bring into my work as well. If you're interested in body work, I would encourage you to book a session and to try more than one therapist. Every therapist brings their unique skills, their unique experience, their unique insight into the session. And if you're interested in learning to be a body worker, we have a 500-hour basic massage therapy program where we start teaching this work from the beginning. And we have several programs, our graduate intern program, where new grads are actually employed by the clinic and do sessions like this one in tandem with master therapists.